Did you know that the last major Ebola outbreak, the West Africa outbreak of 2014 to 2016, killed over 11,000 people across Guinea, Sierra Leone, and Liberia? And did you know that it took the international community 8 full months after the first case was identified before the WHO declared it a global health emergency? Hold on to those facts, because everything we are going to cover tonight or today is going to connect directly back to it. The WHO declared the current Ebola outbreak a global public health emergency. It has now spread to 10 countries, and the US, who left the WHO in January, is not on the table of that emergency response. Russia just hit Kyiv with a hypersonic missile. 528 people are dead from measles in Bangladesh. And the one big beautiful bill is cutting your Medicaid and your food stamps starting this year. Here's exactly what it means for you. The director of the WHO General declared a public health emergency of international concern over the Ebola outbreak in the DRC and Uganda. Officials have increased the number of countries in Africa at risk for Ebola from 3 to 10. The strain confirmed in Bundibugyo virus, as of May 16th, 246 suspected cases and 80 deaths reported. 2 imported cases confirmed in Uganda, including a Congolese man who died in the capital of Kampala. The outbreak is occurring in areas affected by insecurity, population displacement, mining related populations movement, and frequent across-the-border traveling, all of which increase the risk of further transmission. And then this, an angry resident at the epicenter of the outbreak attacked and burned a tent that was part of the health center where people are being treated for the virus. When communities distrust the health response, containing it becomes nearly impossible. That distrust itself is a transmission risk. We saw it in 2014. We are seeing it again now. The CDC issued a level 3 travel notice to DRC, its highest travel alert. In a level 1 for Uganda, a third entry point is now open for Americans traveling from certain high-risk countries back into the US. The WHO is supporting coordination of the response, case management, and cross-border preparedness without the US participation. That coordination is operating with significant gap in both funding and intelligence hearing. We're going to come back to this at the end of the episode. Subscribe right now if you have not, and share this episode. These stories need more eyes on them. Now, 2 more global stories are buried under the headlines this weekend. Russia on Sunday the 21st used a powerful hypersonic missile that has nuclear capabilities to carry out a massive attack on Kyiv, Ukraine. A ballistic missile attack pounded the city, wounding at least 5 people after Moscow threatened retaliation for Ukrainian strikes in Russian-occupied eastern Ukraine. Now, this does not mean a nuclear warhead was used. It means Russia chose to deploy and deliver a system capable of carrying one against civilians' capital city. This is a deliberate signal, not an inventory accident. Now, this comes as Trump announced an unfinalized Iran ceasefire deal on social media the same weekend. The U.S. president simultaneously announcing peace in one theater while Russia escalates in another, and Congress has not voted to authorize any of the military engagement shaping both. And in Bangladesh, as of Sunday, 528 people have died from measles outbreak, mostly children. 82% of those infected are children, a preventable disease. A safe, inexpensive vaccine exists, and 528 people are dead in 2026 because of vaccination gaps and healthcare access failures. That number should not be possible, and most people watching the news this weekend have not heard about it. And just briefly, just so you know what's happening globally, China launched the Shenzhou 23 spacecraft with 3 astronauts heading to space station. And now back to our domestic home front. That's the thing that's affecting our lives directly. The one big beautiful bill is moving through its final stages this Memorial weekend as it did. Here's exactly what it does in plain language. The bill cuts over $1 trillion or 15% from Medicaid spending over the next decade, and cuts 186 billion or 20% from SNAP food stamps over the same period. Now, how might this affect you? Starting December 31st, 2026, your Medicaid renewal goes from once a year to every 6 months. More paperwork, more chances for it to fall through the cracks and lose coverage. Not because you became ineligible, but because the system lost your paperwork and you missed the deadline. And starting January 1st, 2027, adults aged 19 to 64 must work at least 80 hours a month to keep their Medicaid. Parents of guardians of children of 13 and under are exempt. Pregnant and postpartum women are exempt. Medically frail individuals are exempt. Everyone else, prove you worked 80 hours or lose your health coverage. Now, the CBO projects 11.8 million more Americans would become uninsured by 2034. And RFK Jr. told Congress this week that there are no cuts on Medicaid. Factcheck.org flagged that immediately. The nonpartisan Congressional Budget Office, the CBO, estimates the bill will reduce federal Medicaid spending by more than $900 billion over a decade. The bill also contains, as we covered in this channel, the immigration fee hitting asylum seekers, the border security spending surge, the defense budget increase, one bill touching almost every person watching this show today. And Elon Musk this weekend renewed his criticism of the bill, vowing to start a new political party the very next day if Congress passes it. The man who helped engineer Trump return to power is now publicly again threatening to blow the Republican Party over this legislation. That is the level of fracture this bill has created, even inside Trump's own coalition. Now, remember at the beginning the facts that I gave you, the 2014 Ebola outbreak, 8 months before emergency was declared, 11,000 people dead, and it was American funding, you can say, with the assistance of WHO. Now, tonight, the WHO has declared this outbreak a global emergency within weeks, which is faster. Now, what is different in the 2026? The US is not part of the WHO, as I keep mentioning here multiple times. The country that contained at least the last major outbreak is not at the coordination table for this one. And domestically, the bill being voted on this weekend cuts over $1 trillion from the health program that low-income Americans depend on. Now, the Did You Know from tonight is not just about history, it's a mirror. And what it's reflecting right now is a country that contained the world's worst Ebola outbreak back in 2014, now watching a new one spread to 10 countries from outside a room where the response is being coordinated. A 13-month-old girl named Janat cries as her mother, Sohana, a garment worker, tries to feed her. The child is hospitalized for measles in Dhaka, Bangladesh. 13-month-old, a vaccine-preventable disease in 2026. And in Washington this night, senators negotiated how to cut from health programs while their families gather for Memorial Day barbecues as it happened on Monday. Share this episode, subscribe, hit the notification bell, drop a comment. Tell me which story you're carrying with you tonight. I leave you in the care of Allah subhanahu wa ta'ala. Assalamu alaikum wa rahmatullahi wa barakatuh. Fi amanillah.